Question 106. An SP technician is meticulously inspecting a delicate ophthalmic tray at the lighted workstation, actively ensuring absolutely zero bioburden remains because they know a single dirty instrument discovered in the operating room directly degrades the facility financial reimbursement scores based on what specific national standardized patient evaluation survey? Option A. The randomized internal peer review quality audit. Option B. The standardized patient prospective hospital experience evaluation. Option C. The federal occupational hazard exposure log. Option D. The daily vendor managed inventory discrepancy report. Correct answer B. Knowledge point explanation. Core Rationale. The Hospital Consumer Assessment of Healthcare Providers and Systems is a standardized survey utilized nationwide to collect data directly from patients regarding their perspectives on their hospital care. Because a facility Medicare reimbursement is tied to these scores, providing flawless sterile instruments directly supports positive patient outcomes and overall satisfaction. Trap analysis. Option A. This is wrong for this scenario because an internal peer review involves staff evaluating each other, not patients evaluating the hospital. This would be the correct answer if the director was analyzing how accurately the prep and pack technicians were grading each other instrument assembly techniques. Option C. This is wrong for this scenario because the occupational hazard log tracks employee workplace injuries, not patient satisfaction. This would be the correct answer if the facility was legally required to review the annual accumulation of sharps puncture injuries sustained by technicians at the decontamination sinks. Option D. This is wrong for this scenario because a vendor discrepancy report deals with missing surgical supplies from outside companies. This would be the correct answer if the department was investigating why a loaned orthopedic implant set arrived from the manufacturer missing 3 critical bone screws. Concept extension. A single dirty instrument discovered in the operating room delays the surgery, increases patient time under anesthesia, and directly degrades the hospital consumer assessment scores. Question 107. While breaking down a massive cardiovascular setup in the decontamination area, a technician carefully segregates the blue polypropylene sterilization wrappers into a designated recycling bin rather than the standard trash receptacle to reduce environmental impact. What specific facility-wide resource management program is this technician actively supporting? Option A. The Periodic Automatic Replenishment System. Option B. The Lean Manufacturing Optimization Workflow. Option C. The Institutional Environmental Sustainability Initiative. Option D. The Centralized Case Cart Distribution Network. Correct answer C. Knowledge point explanation. Core Rationale. Sustainability refers to practices designed to minimize a healthcare facility negative impact on the environment. Sterile processing departments generate massive amounts of waste, so active participation in sustainability programs through recycling clean plastics, conserving utility water during washing, and reducing energy consumption is a critical modern operational objective. Trap analysis. Option A. This is wrong for this scenario because this is an inventory management protocol for restocking supplies, not a program for managing environmental waste. This would be the correct answer if the technician was utilizing a handheld scanner to reorder enzymatic detergent gallons to bring the shelf stock back up to a pre-established baseline level. Option B. This is wrong for this scenario because lean manufacturing eliminates procedural steps and wasted time rather than physically recycling ecological waste. This would be the correct answer if the technician actively reorganized their prep workstation to completely eliminate 10 unnecessary physical steps, walking back and forth to retrieve indicator tape. Option D. This is wrong for this scenario because a distribution network physically moves sterile goods to the operating room. It does not process post-surgical refuse. This would be the correct answer if the technician was loading a designated enclosed trolley with a specific individualized set of sterile trays matching a surgeon preference card. Concept extension. Many modern facilities invest in automated water reclamation systems that capture, filter, and reuse the final rinse water from mechanical washers to supply the initial flush cycle of the next load, drastically improving sustainability. Question 108. while physically stocking the sterile storage shelves, an SP technician must find space for 50 new boxes of single-use battery-powered bone drills that recently replaced the heavy reusable stainless steel models. When the facility supply chain originally determined whether to implement this specific inventory change, what comprehensive variables did they calculate? Option A. The exclusive preference of the hospital infection prevention director. Option B. The physical weight limits of the dynamic air removal autoclaves. Option C. A combination of the surgeon clinical preference, the departmental storage footprint, and the long-term financial cost. Option D. The immediate availability of high-level liquid disinfectant soaking basins. Correct answer C. Knowledge point explanation. Core rationale. Deciding between reusable and disposable surgical instruments is a highly complex logistical and financial decision. The facility must simultaneously evaluate if the surgeons will accept the feel of the disposable tool, if the department has enough physical shelf space to store hundreds of single-use boxes, and whether the continuous purchasing cost outweighs the labor and utility costs of reprocessing durable equipment. Trap analysis. Option A. This is wrong for this scenario because while infection control is consulted, the decision heavily involves supply chain finances and surgical approval, not just one director's sole opinion. This would be the correct answer if the leadership was asked who holds the ultimate authority to officially establish a new quarantine parameter for trays exposed to an unknown airborne pathogen. Option B. This is wrong for this scenario because physical autoclave limits only dictate how a reusable tray is processed, not whether the facility should buy disposable items instead. This would be the correct answer if the assembly team was calculating how to safely divide a massive 40-pound vendor loaner set into two separate rigid containment vessels to prevent wet packs. Option D. This is wrong for this scenario because bone drills are critical devices requiring terminal sterilization, rendering the availability of high-level disinfection basins completely irrelevant. This would be the correct answer if the department was evaluating its capacity to safely reprocess a sudden influx of semi-critical flexible laryngoscopes. Concept extension. If a disposable item is selected, the sterile processing department must actively coordinate with the supply chain network to ensure the par levels are precisely maintained so the operating room never runs completely out of stock during an emergency procedure. Question 109. An SP technician is manually scrubbing a heavily soiled kerosene rongeur used to bite away hardened tissue during a spinal laminectomy. To fully understand the anatomical density of the fragments they are removing, the technician recalls the biological process where softer human cartilage gradually transforms into solid bone. What is the specific medical term for this physiological hardening process? Option A. The structural ossification phase. Option B. The active cellular osmosis mechanism. Option C. The inflammatory arthritis degradation. Option D. The systemic calcification distribution. Correct answer A. Knowledge point explanation. Core rationale. Processing orthopedic and spinal instruments requires knowledge of the skeletal system. Ossification is the specific biological process of bone tissue formation where specialized cells physically replace softer connective cartilage matrices with extremely dense hardened bone material. This density explains why biting instruments must be exceptionally sharp and resilient. Trap analysis. Option B. This is wrong for this scenario because osmosis dictates how water molecules travel across membranes, not how the human skeleton is constructed. This would be the correct answer if the technician was explaining the core scientific principle utilized by the department's highly specialized reverse osmosis water purification system. Option C. This is wrong for this scenario because arthritis is the destructive breakdown of joint tissue, which is the exact opposite of healthy bone formation. This would be the correct answer if the technician was identifying the specific degenerative pathology that ultimately necessitated a patient undergoing a total knee arthroplasty procedure. Option D. This is wrong for this scenario because calcification simply refers to the generic accumulation of calcium salts in soft tissues, not the highly organized structural engineering of creating a complete skeletal bone. This would be the correct answer if the technician was describing the hardened mineral plaque deposits that form on a mechanical washer heating coil due to utilizing untreated utility water. Concept extension. Instruments used to cut ossified tissue such as osteotomes and rongeurs suffer significant physical trauma during surgery and must be meticulously evaluated at the lighted workstation for microscopic cracks or dull bad edges before being packaged. Question 110. During the morning startup procedures, a technician reaches into the bottom of the main steam autoclave and pulls out the metal strainer to meticulously scrub away trapped indicator tape and lint. If this specific daily maintenance task is skipped, what catastrophic mechanical failure will occur during the next thermal cycle? Option A. The heavy internal chamber walls will immediately buckle inward due to massive vacuum implosion forces. Option B. The cold atmospheric air and condensed water will be physically blocked from exiting the chamber. Option C. The biological indicator vial will prematurely detonate before the exposure phase commences. Option D. The external steam jacket will rapidly overheat and spontaneously ignite the synthetic wrappers. Correct answer B. Knowledge point explanation. Core rationale. The chamber drain is the absolute lowest and coolest point in a steam sterilizer. It serves as the single exit path for heavy cold air to be pushed out as hot steam enters and for liquid condensate to drain away. If the drain screen is occluded by debris, the cold air is permanently trapped inside, completely shielding the surgical instruments from the sterilizing steam and guaranteeing a wet, unsterile load. Trap analysis. Option A. This is wrong for this scenario because modern commercial sterilizers are structurally engineered with thick steel to withstand extreme negative pressure, preventing physical implosion. This would be the correct answer if a massive outdated industrial steam vessel completely lacked a functioning pressure relief safety valve and suddenly lost all internal structural integrity. Option C. This is wrong for this scenario because a blocked drain prevents heat from penetrating the load, which would prevent the vial from breaking, not cause it to detonate. This would be the correct answer if the glass indicator vial was physically crushed by an improperly secured heavy retractor resting directly on top of it within the basket. Option D. This is wrong for this scenario because a blocked internal drain does not directly cause the separate exterior jacket to catch fire. This would be the correct answer if highly combustible paper goods were loaded carelessly so they were directly touching the exposed blazing hot metal walls of the inner chamber. Concept extension. Maintaining a clean drain is so critical to the thermodynamic physics of sterilization that surveying bodies will instantly issue a severe citation if they observe a technician attempting to run a cycle with a visibly soiled or obstructed strainer. Question 111. While actively assembling a heavy orthopedic tray, an SP technician suffers a minor skin abrasion. The occupational health nurse applies a specific chemical agent directly to the technician's broken skin to retard bacterial replication before bandaging it. What is the precise classification of this chemical applied to living tissue? Option A. Phenolic compounds. Option B. Environmental disinfectants. Option C. Halogen-based solutions. Option D. Topical antiseptics. Correct answer D. Knowledge point explanation. Core rationale. To maintain occupational safety, technicians must differentiate between chemical classes. Antiseptics such as povidone iodine or rubbing alcohol are chemical formulations explicitly engineered to be physiologically safe for application on animate living human tissues to halt microbial growth without causing severe cellular necrosis. Trap analysis. Option A. This is wrong for this scenario because these are highly toxic intermediate-level chemicals that cause severe dermal burns. This would be the correct answer if the technician was asked to identify a chemical class whose residue can be dangerously reactivated by floor mopping. Option B. This is wrong for this scenario because disinfectants are formulated strictly for use on inanimate objects like tables and machinery, never human skin. This would be the correct answer if the nurse was wiping down the examination table after the technician left the clinic. Option C. This is wrong for this scenario because while some halogens are formulated as antiseptics, bleach is a halogen that destroys human tissue. This would be the correct answer if the technician was asked to identify the broad chemical family that includes both skin-safe iodine and highly corrosive sodium hypochlorite. Concept extension. If a technician accidentally spills an environmental disinfectant on their skin, they must bypass the antiseptic station and proceed directly to the emergency drench shower to flush the corrosive chemical away with copious amounts of water. Question 112. While physically transferring a sealed orthopedic tray from a transport cart to a storage shelf, an SP technician verifies the package integrity based on event-related sterility principles. According to this modern storage concept, which specific action occurs after the sterile boundary is intentionally breached and therefore has zero impact on the package's previous shelf life integrity? Option A. The clinical application of the device by the surgeon. Option B. The structural integrity of the synthetic wrapper. Option C. The fluctuating humidity levels within the storage room. Option D. The physical handling techniques used during cart transport. Correct answer A. Knowledge point explanation. Core rationale. Event-related sterility dictates that an item remains sterile indefinitely until a specific physical event like a tear or moisture intrusion compromises the barrier. Once the operating room nurse intentionally breaks the seal to hand the tool to the surgeon, the sterility timeline ends. How the surgeon ultimately utilizes that tool during the procedure has absolutely no retrospective effect on whether the item was properly sterile while sitting on the storage shelf. Trap analysis. Option B. This is wrong for this scenario because poor wrapper quality is a primary event that causes premature barrier failure during storage. This would be the correct answer if the manager was explaining why cheap, easily punctured packaging materials cause an unacceptable spike in contamination rates before the trays ever reach the surgical core. Option C. This is wrong for this scenario because humidity fluctuations are critical environmental events that can create wet packs or dry brittle paper. This would be the correct answer if the manager was explaining why the central air conditioning system malfunctioning directly ruined the entire sterile inventory. Option D. This is wrong for this scenario because dragging or dropping trays are physical events that actively destroy the sterile barrier. This would be the correct answer if the manager was citing a technician for incorrectly sliding a heavy orthopedic set across a wire rack. Concept extension. While expiration dates are mostly obsolete for internal hospital sterilized items, commercially manufactured sterile supplies still carry strict expiration dates because the manufacturer cannot legally guarantee the stability of their proprietary adhesive seals beyond a certain time frame. Question 113. During the scheduled weekly deep cleaning of the sterile storage area, an SP technician prepares to physically wipe down the heavy wire racks. To strictly protect the sterile inventory from chemical splashes and dislodged dust, what physical action must the technician take regarding the wrapped trays currently resting on those racks? Option A. Slide the packages temporarily to one side of the rack. Option B. Pack the items into standard corrugated cardboard shipping boxes. Option C. Pack the items into plastic-lined corrugated cardboard boxes. Option D. Completely remove the packages and transfer them to a clean cart. Correct answer D. Knowledge point explanation. Core rationale. You cannot properly sanitize a shelf while sterile items are still occupying that space. The chemicals utilized for cleaning can splash onto the wrappers, and the physical act of wiping stirs up settled dust. Aseptic protocols strictly require the technician to completely remove all sterile packages, transfer them to a safe, clean transport cart, sanitize the shelf, allow it to dry entirely, and then carefully restock the items. Trap analysis. Option A. This is wrong for this scenario because sliding heavy trays causes friction tears, and cleaning immediately adjacent to the packs still exposes them to chemical splatter. This would be the correct answer if the question asked to describe a highly negligent cleaning practice that guarantees immediate sterile barrier contamination. Option B. This is wrong for this scenario because corrugated cardboard harbors insects, generates massive amounts of lint, and is strictly banned from the sterile storage area. This would be the correct answer if the technician was packing obsolete stainless steel instruments to be shipped back to the external corporate repair facility via a standard postal carrier. Option C. This is wrong for this scenario because even with a plastic liner, the exterior of the cardboard box still introduces unacceptable contaminants into the restricted room. This would be the correct answer if the facility was receiving a massive shipment of unsterile medical-grade paper pouches at the hospital external loading dock. Concept extension. The cleaning of the sterile storage area must follow a strict top-to-bottom methodology, ensuring that dust dislodged from the ceiling vents or upper shelves does not settle onto shelves that have already been sanitized. Question 114. An SP technician physically transports a new shipment of pure ethylene oxide gas cartridges to the low-temperature sterilization area. Due to the extreme combustibility of this specific chemical, where must the technician physically store these unbroken cartridges? Option A. In a standard reinforced oxygen cylinder holding room. Option B. On an open wire rack situated directly beside the sterilizer unit. Option C. Inside the climate-controlled sterile storage warehouse. Option D. Inside an externally exhausted flammable liquid storage cabinet. Correct answer D. Knowledge point explanation. Core rationale. Ethylene oxide is an incredibly effective sterilant, but it is also highly toxic, explosive, and flammable. Fire safety codes and occupational health regulations strictly mandate that these unpunctured chemical cartridges must be housed in a specialized fire-resistant flammable liquid storage cabinet that features continuous negative pressure ventilation, exhausted directly to the outside atmosphere to prevent the buildup of explosive vapors. Trap analysis. Option A. This is wrong for this scenario because oxygen is an oxidizer that violently fuels fires, creating a catastrophic explosion risk if stored alongside highly flammable ethylene oxide. This would be the correct answer if the technician was securing heavy pressurized green steel tanks used for patient respiratory support. Option B. This is wrong for this scenario because open shelves provide absolutely no fire protection or vapor ventilation if a cartridge accidentally leaks. This would be the correct answer if the technician was storing boxes of completely inert, non-toxic biological indicator vials for routine daily testing. Option C. This is wrong for this scenario because sterile storage is meant for processed surgical inventory, not raw, highly dangerous industrial chemicals. This would be the correct answer if the technician was transporting a fully cooled and aerated implant tray that had successfully completed its low-temperature cycle. Concept extension. If the ventilation system within the dedicated ethylene oxide room fails, an audible and visual alarm must immediately activate, prompting the technicians to instantly evacuate the area to avoid exposure to the carcinogenic fumes. Question 115. An assembly technician reviews a digital surgeon preference card to physically pick the exact retractors, sutures, and sponges required for a scheduled craniotomy. The technician loads these specific items onto a closed-wheeled trolley destined for that specific operating room. Which dedicated inventory distribution model is the technician actively executing? Option A. The individual clinical requisition process. Option B. The specialized surgical case cart framework. Option C. The periodic automatic replenishment stock method. Option D. The bulk department-wide exchange cart system. Correct answer B. Knowledge point explanation. Core rationale. A preference card acts as an exact recipe for a specific surgical procedure. When a technician utilizes this card to gather the precise sterile trays and disposable supplies needed for one individual patient surgery and secures them inside a dedicated transport trolley, they are operating the case cart system. This model is the gold standard for efficiently supplying the operating room without forcing them to hoard excess inventory. Trap analysis. Option A. This is wrong for this scenario because a requisition is an isolated on-demand request for a single missing item, not the proactive assembly of an entire procedural setup based on a MasterCard. This would be the correct answer if the operating room suddenly called the sterile core to rapidly request an extra box of specialized hemostatic clips mid-surgery. Option C. This is wrong for this scenario because a periodic system is designed to top off general ward supplies to a baseline, not to build unique patient-specific surgical setups. This would be the correct answer if the technician was utilizing a barcode scanner in the maternity ward to bring their standard stock of sterile gauze pads back up to 50 boxes. Option D. This is wrong for this scenario because the exchange system involves swapping massive identical carts to supply a whole department, not picking individual items for a single surgery. This would be the correct answer if the technician pushed a fully loaded bulk supply shelving unit into the intensive care unit and hauled away the empty duplicate unit. Concept extension. If a case is cancelled, the intact case cart must be returned to the sterile processing department, where the technician must meticulously disassemble the setup and return the unused items to the sterile storage shelves to prevent massive financial inventory losses. Question 116. An SP technician facilitates the physical workspace access for a clinical engineering team preparing to execute a scheduled diagnostic evaluation on the massive departmental cart washer. What is the fundamental operational objective of this specific preventive maintenance activity? Option A. To repair a sudden mechanical breakdown that caused a cycle failure. Option B. To proactively identify and resolve potential mechanical issues before they trigger a catastrophic operational failure. Option C. To respond to an urgent clinical complaint regarding inadequate water pressure. Option D. To manually clean the internal rotary spray arms following a heavily soiled load. Correct answer B. Knowledge point explanation. Core rationale. Preventive maintenance is a proactive asset management strategy. By scheduling regular inspections, lubrication, and part replacements, the facility aims to identify and fix minor wear and tear before it escalates into a major mechanical breakdown that halts departmental production. Trap analysis. Option A. This is wrong for this scenario because fixing a sudden breakdown is classified as reactive repair maintenance, not preventive maintenance. This would be the correct answer if the technician called engineering specifically because the sterilizer door motor suddenly jammed shut and trapped a load inside. Option C. This is wrong for this scenario because responding to a complaint is a reactive troubleshooting response. This would be the correct answer if a facility's plumber arrived to investigate why the preparation sink faucets suddenly lost all municipal water flow. Option D. This is wrong for this scenario because routine manual cleaning is the daily responsibility of the sterile processing technician, not a clinical engineering evaluation. This would be the correct answer if the question asked to describe a daily operator maintenance task for the automated washer disinfector. Concept extension. Accreditation surveyors actively audit preventive maintenance logs to ensure hospitals are strictly adhering to the exact service intervals mandated by the original equipment manufacturer. Question 117. An SP technician physically arranges their illuminated inspection workstation to maintain absolute compliance with mandated safety protocols, anticipating a sudden unannounced regulatory inspection. In the context of quality management, this proactive execution of continuous survey readiness is driven by what specific organizational factor? Option A. Root cause analysis execution. Option B. Failure mode and effects analysis modeling. Option C. Departmental leadership accountability. Option D. The vendor tracking system deployment. Correct answer C. Knowledge point explanation. Core rationale. Survey readiness means maintaining an environment that is always prepared for an unannounced regulatory inspection. Cultivating this culture of continuous compliance relies heavily on departmental leadership, as managers and supervisors must constantly set expectations, monitor daily workflows, and actively enforce adherence to patient safety policies, empowering technicians to execute perfectly. Trap analysis. Option A. This is wrong for this scenario because this is a retrospective investigative tool used to find the origin of an error that already happened. This would be the correct answer if the supervisor was investigating exactly how a dirty retractor bypassed the inspection phase and reached the operating room. Option B. This is wrong for this scenario because this is a proactive risk assessment tool used before a new process is implemented. This would be the correct answer if the leadership team was brainstorming potential failure points prior to installing a new robotic tracking software system. Option D. This is wrong for this scenario because a tracking system manages physical inventory logistics, not the overarching culture of regulatory compliance. This would be the correct answer if the supervisor was teaching staff how to log the physical arrival of a loaned maxillofacial tray from an external sales representative. Concept extension. While leadership establishes the framework for survey readiness, every individual technician shares the operational responsibility to execute those standards flawlessly during their daily physical tasks. Question 118. An SP technician logs a returned intravenous infusion pump into the department asset management software terminal after completing the physical manual disinfection process. Which specific piece of data is legally excluded from the equipment tracking profile under strict privacy regulations? Option A. The specific clinical diagnosis of the individual who previously utilized the device. Option B. The physical location where the equipment is currently deployed or stored. Option C. The documented history of scheduled preventive maintenance evaluations. Option D. The detailed history of physical repairs performed by the clinical engineering team. Correct answer A. Knowledge point explanation. Core Rationale. Asset tracking software manages the physical logistics and maintenance history of hospital equipment. Federal patient privacy laws strictly prohibit sharing protected health information such as a patient medical diagnosis with sterile processing staff who do not require that clinical data to safely disinfect the machine. Trap analysis. Option B. This is wrong for this scenario because tracking the physical location is the primary logistical purpose of the software. This would be the correct answer if the technician needed to pinpoint exactly which intensive care room was hoarding for and used sequential compression devices. Option C. This is wrong for this scenario because verifying PM history is critical for ensuring the equipment is legally permitted to be distributed. This would be the correct answer if the technician was verifying that the pump had received its mandatory annual safety calibration before sending it to a patient. Option D. This is wrong for this scenario because maintaining a repair log documents the mechanical reliability of the capital asset. This would be the correct answer if the department manager was reviewing historical data to justify replacing an aging fleet of continuously malfunctioning patient monitors. Concept extension. When physically treating mobile equipment with environmental disinfectants, the technician must treat all devices with the same high level of standard precautions regardless of what disease the prior patient may have had. Question 119. While physically loading a massive terminal steam sterilizer, an SP technician verifies the drain function and mentally visualizes the internal chamber, the external jacket, and the thermostatic trap. What is the primary operational necessity for the technician to comprehend this structural anatomy? Option A. To acquire the proper credentials to perform complex electrical repairs on the motherboard. Option B. To understand exactly how the thermodynamic system operates as a cohesive unit to achieve lethality. Option C. To chemically synthesize the specific liquid sterilant required to fuel the exposure phase. Option D. To determine the precise biological incubation temperatures for the fluorescent test vials. Correct answer B. Knowledge point explanation. Core Rationale. Processing technicians are operators, not mechanical engineers. However, they must understand the structural anatomy of the sterilizer, how steam fills the jacket to preheat the walls, how air exits the thermostatic trap to properly load the chamber, interpret cycle printouts accurately, and immediately recognize thermodynamic failures during the process. Trap analysis. Option A. This is wrong for this scenario because central sterile technicians are explicitly forbidden from performing complex electronic or mechanical repairs. This would be the correct answer if the question asked to describe the primary job function of a certified biomedical equipment technician. Option C. This is wrong for this scenario because steam sterilizers utilize utility water converted to vapor, not chemically synthesized liquids. This would be the correct answer if the technician was meticulously mixing a 2-part peracetic acid solution in a manual soaking basin. Option D. This is wrong for this scenario because incubation temperatures are dictated by the biological indicator manufacturer instructions, not the structural anatomy of the autoclave itself. This would be the correct answer if the technician was programming the digital interface of a freestanding biological autoreader block. Concept extension. If a technician does not understand that the drain is the coldest part of the chamber anatomy, they might improperly place the biological challenge pack on the top shelf, resulting in an invalid and unsafe lethality test. Question 120. While physically programming a specialized 18-minute steam exposure cycle at 273 degrees Fahrenheit, an SP technician prepares to eradicate a highly resilient biological entity from a craniotomy tray. Which specific pathogenic entity is scientifically classified as an abnormal misfolded protein rather than a living virus requiring this extreme protocol? Option A, the bloodborne hepatitis B pathogen. Option B, the highly contagious Ebola pathogen. Option C, a transmissible spongiform prion. Option D, the airborne varicella zoster pathogen. Correct answer C. Knowledge point explanation. Core rationale. While viruses are infectious agents containing genetic material, a prion is entirely unique in medical microbiology. It is exclusively an abnormal misfolded pathogenic protein completely devoid of DNA or RNA. Prions cause fatal neurodegenerative diseases like Creutzfeldt-Jakob disease and are incredibly resistant to standard thermal sterilization cycles. Trap analysis. Option A. This is wrong for this scenario because hepatitis B is a highly resilient living viral pathogen targeting the liver. This would be the correct answer if the technician was identifying the specific virus that healthcare workers are heavily vaccinated against to prevent occupational sharps exposure infections. Option B. This is wrong for this scenario because Ebola is a severe viral organism causing hemorrhagic fever. This would be the correct answer if the technician was donning extreme positive pressure encapsulated biohazard suits to decontaminate materials from a highly lethal viral outbreak. Option D. This is wrong for this scenario because varicella zoster is the living virus responsible for causing chickenpox and shingles. This would be the correct answer if the technician was investigating an airborne viral pathogen that remains dormant in the host nervous system for decades before reactivating. Concept extension. Instruments exposed to prion demand exceptionally rigorous protocols, often requiring extended 18-minute steam exposure cycles at 273 degrees Fahrenheit to effectively denature the resilient protein structures. Question 121. While physically donning heavy-duty decontamination gloves to sort a cart of bloody instruments from a patient with an unknown respiratory illness, an SP technician applies the foundational theory of standard precautions. According to this universal infection control principle, how must the technician physically handle all human blood and bodily fluids? Option A. As potentially healthy unless the patient exhibits visible symptoms of a viral infection. Option B. As infectious only if the individual belongs to a high-risk epidemiological category. Option C. As entirely safe for handling if the patient has received a negative diagnostic test. Option D. As inherently infectious and requiring full barrier protection regardless of the diagnosis. Correct answer D. Knowledge point explanation. Core rationale. Standard precautions is the primary strategy for successful infection control in healthcare. It dictates that because many patients harbor asymptomatic or undiagnosed bloodborne pathogens, technicians must physically treat all human blood bodily fluids, non-intact skin and mucous membranes as if they are known to be infectious. This universal approach ensures that every staff member is consistently protected behind a barrier of personal protective equipment for every task. Trap analysis. Option A. This is wrong for this scenario because relying on visible symptoms is a reactive and dangerous failure of infection control. Many lethal diseases are invisible. This would be the correct answer if the question asked to describe an obsolete and scientifically discredited pre-1980s approach to hospital hygiene. Option B. This is wrong for this scenario because standard precautions eliminate the practice of profiling patients based on risk categories, treating everyone with the same high level of care. This would be the correct answer if the question described the historical category-specific isolation protocols that were replaced by the modern universal system. Option C. This is wrong for this scenario because diagnostic tests can yield false negatives or fail to test for every possible pathogen. This would be the correct answer if the question asked for the baseline requirement to permit a family member to visit a patient in a non-restricted non-isolated standard hospital ward. Concept extension. Standard precautions serve as the primary defensive layer for sterile processing technicians. Additional transmission-based precautions such as airborne or droplet are added on top of the standard layer only when a specific known contagious pathogen is identified. Question 122. While vigorously utilizing a nylon bristle brush to manually dislodge compacted bone debris from a complex orthopedic reamer at the decontamination sink, an SP technician reflects on the ultimate purpose of their physical labor. Beyond preventing infection, providing a flawlessly clean and functional product directly impacts which specific aspect of the patient journey? Option A. The individualized surgical outcomes. Option B. The administrative billing accuracy. Option C. The facility annual energy consumption. Option D. The technician professional certification status. Correct answer A. Knowledge point explanation. Core rationale. Quality in sterile processing is defined by the excellence of the final product. A high-quality instrument tray directly supports positive patient outcomes by ensuring the surgeon can operate without equipment malfunctions, preventing unnecessary surgical delays, and eliminating the risk of introducing toxic residues or pathogens into the patient internal cavity. Trap analysis. Option B. This is wrong for this scenario because instrument quality affects the surgery itself, not the administrative processing of insurance claims. This would be the correct answer if the educator was discussing the primary function of the hospital's central clinical coding department. Option C. This is wrong for this scenario because cleaning a single instrument does not significantly alter the overall electricity or gas usage of the massive hospital building. This would be the correct answer if the technician was participating in a facility-wide green initiative to install low-flow faucets and LED lighting in the decontamination area. Option D. This is wrong for this scenario because certification is a personal credential achievement for the worker, not a direct clinical impact on the patient physical surgical wound. This would be the correct answer if the technician was fulfilling their annual continuing education requirements to maintain their status as a certified professional. Concept extension. A negative surgical outcome such as an instrument failing mid-procedure can lead to extended anesthesia time, increased blood loss, and potentially a secondary open surgery to retrieve a broken instrument fragment. Question 123. A technician is performing the daily morning qualification tests on a high-vacuum steam sterilizer. They place a specific self-contained Class 2 chemical indicator inside an empty chamber and initiate a 3.5-minute cycle at 273 degrees Fahrenheit. What is the precise name of this mandatory air removal efficiency test? Option A. The biological challenge device. Option B. The external process verification test. Option C. The integrated lethality monitor. Option D. The Bowie-Dick test. Correct answer D. Knowledge point explanation. Core rationale. Dynamic air removal sterilizers rely on a functioning vacuum system to extract air so steam can penetrate the load. The Bowie-Dick test is a specialized FDA Class 2 chemical indicator designed specifically to detect air leaks, inadequate air removal, and non-condensable gases. It must be performed daily in an empty chamber to ensure the machine mechanical air expulsion systems are fully operational before any patient loads are processed. Trap analysis. Option A. This is wrong for this scenario because a biological challenge uses living spores to prove microbial kill, not a chemical sheet to test air removal physics. This would be the correct answer if the technician was placing a rapid readout spore vial into the first full load of the day to verify the sterilizer lethality. Option B. This is wrong for this scenario because external verification refers to the Type 1 indicator tape used on every individual package to show it was exposed to heat. This would be the correct answer if the technician was checking the stripes on the tape of a cooled orthopedic tray to confirm it passed through the chamber. Option C. This is wrong for this scenario because an integrated monitor is placed inside every tray to mimic a biological indicator reaction to all sterilization parameters. This would be the correct answer if the technician was inserting a specialized chemical strip into the center of a complex total hip set to monitor interior steam penetration. Concept extension. If the Bowie-Dick test sheet shows an uneven color change or a lighter spot in the center, the technician must immediately shut down the sterilizer, tag it as out of service, and notify clinical engineering for a vacuum system repair. Question 124. While manually cleaning an automated breast pump returning from the maternity ward, an SP technician identifies that the primary electrical cord has several deep cracks and exposed copper wiring. According to facility safety protocols, when is the technician officially responsible for executing this specific visual hazard inspection? Option A. Only during the annual preventive maintenance evaluation by engineering. Option B. Exclusively when a clinical nurse submits a formal hardware complaint. Option C. Whenever the equipment is physically handled and inspected by the SP staff. Option D. Only when the device demonstrates a total lack of power during operation. Correct answer C. Knowledge point explanation. Core rationale. Patient safety is a continuous non-stop responsibility. While clinical engineers perform deep technical diagnostics, sterile processing technicians are the primary guardians who handle mobile equipment between every patient use. Technicians are strictly responsible for performing a visual safety check for obvious hazards such as frayed cords or missing components every single time they process a device for reuse. Trap analysis. Option A. This is wrong for this scenario because waiting an entire year to check for a frayed cord is dangerously negligent and invites a patient electrocution. This would be the correct answer if the question asked when a certified technician should perform a specialized internal electrical leakage current test according to national safety standards. Option B. This is wrong for this scenario because technicians must catch errors before they reach the clinical units. Relying on nurses to find hazards is a failure of the department quality control. This would be the correct answer if the department manager was reviewing a formal incident report generated by the operating room after a drill malfunctioned mid-procedure. Option D. This is wrong for this scenario because a device can still have power while possessing a dangerous exposed wire that could ignite oxygen or burn a patient. This would be the correct answer if the technician was performing the very first step of reactive mechanical troubleshooting after a piece of equipment failed to turn on at the bedside. Concept extension. If a technician identifies a hazard, they must immediately apply a defective do not use tag, remove the device from the distribution queue, and log the repair request in the asset tracking software. Question 125. While utilizing a designated mop to physically clean a massive biological spill off the decontamination floor, an SP technician selects a specific liquid chemical agent. To ensure staff safety, the technician actively avoids a specific class of disinfectant because its hazardous chemical residue can be dangerously reactivated later by simple ambient moisture. Which class of disinfectant possesses this unique and hazardous cumulative property? Option A. Standard aqueous chlorine mixtures. Option B. High-concentration phenolic compounds. Option C. Rapidly evaporating isopropyl alcohol solutions. Option D. Low-level quaternary ammonium complexes. Correct answer B. Knowledge point explanation. Core rationale. Phenolics are intermediate-level disinfectants that are notorious for leaving a persistent chemical film on environmental surfaces. A defining and hazardous characteristic of phenolics is their ability to stay dormant on a floor or table and then become chemically active again when exposed to moisture. This reactivation can cause severe skin irritation or chemical burns to unsuspecting staff members or infants in nursery settings. Trap analysis. Option A. This is wrong for this scenario because chlorine is highly unstable and dissipates into the air, rapidly leaving behind only a harmless salt residue that cannot be reactivated into a biocide. This would be the correct answer if the technician was asked to identify a fast-acting but highly corrosive halogen agent used to decontaminate large environmental blood spills. Option C. This is wrong for this scenario because alcohol evaporates entirely and leaves zero residue on the surface to be reactivated. This would be the correct answer if the technician was selecting a chemical to rapidly disinfect a small clean horizontal surface between patients without needing to rinse. Option D. This is wrong for this scenario because quaternary ammonium compounds do leave a residue, but it is not chemically reactivated by moisture, it simply builds up as a dull tacky film. This would be the correct answer if the technician was identifying the most common low-level disinfectant utilized for routine cleaning of non-critical environmental surfaces like walls and cabinets. Concept extension. Due to this hazardous reactivation property and their high toxicity to human skin, many modern healthcare facilities have strictly banned the use of phenolics in neonatal and pediatric areas. Question 126. While physically receiving a sealed biohazard bin containing bloody craniotomy instruments, an SP technician glances at the attached surgical schedule and notes the patient suffers from severe encephalopathy. Using the anatomical root and suffix of this word, how must the technician accurately define this medical condition to anticipate the required decontamination protocols? Option A. A localized inflammation of the hepatic liver tissue. Option B. A generalized pathological disease of the brain. Option C. A benign fluid-filled sac situated near a joint capsule. Option D. An acute structural inflammation of a skeletal joint. Correct answer B. Knowledge point explanation. Core rationale. Medical terminology is deciphered by breaking down the word elements. The root encephalo specifically refers to the brain and the suffix pathy translates to disease. Therefore, encephalopathy is a broad term defining any disease or malfunction of the brain, alerting the SP technician that instruments from this case may require specialized neurosurgical processing. Trap analysis. Option A. This is wrong for this scenario because it describes a liver condition. This would be the correct answer if the term was hepatitis, where hepa means liver and itis means inflammation. Option C. This is wrong for this scenario because a fluid-filled sac is a different medical entity. This would be the correct answer if the technician was defining a ganglion cyst or a simple bursa. Option D. This is wrong for this scenario because it refers to a joint condition. This would be the correct answer if the technician was defining arthritis, where arthro means joint and itis means inflammation. Concept extension. Identifying brain-related terminology is crucial for safety. Certain types of encephalopathy are linked to prion, which mandate the use of the most rigorous extended sterilization cycles to ensure patient safety. Question 127. While collecting a puncture-resistant sharps container from a procedural room, an SP technician ensures the biohazard label is prominently displayed. According to regulatory safety definitions, what specific characteristic classifies waste as biohazardous? Option A. Any discarded material that originated from an automated mechanical washer. Option B. Discarded items containing infectious agents that pose a risk to human health. Option C. Liquid waste strictly collected from a clogged steam sterilizer drain line. Option D. Residual chemical agents released into the atmosphere during a gas cycle. Correct answer B. Knowledge point explanation. Core rationale. Biohazardous waste is formally defined as any waste product containing infectious agents or pathogens in sufficient concentrations that they could cause illness in a susceptible host. This includes blood-soaked items, used needles, and human tissue. Technicians must handle all such waste with extreme caution and follow strict federal disposal protocols to prevent environmental contamination. Trap analysis. Option A. This is wrong for this scenario because items exiting a washer are thermally disinfected and no longer biohazardous. This would be the correct answer if the question asked to describe the physical state of items that are safe for technicians to handle without full decontamination personal protective equipment. Option C. This is wrong for this scenario because sterilizer condensate is mostly water and steam and the heat would have already killed any pathogens. This would be the correct answer if the question asked to identify the liquid byproduct generated during the cool-down phase of a steam cycle. Option D. This is wrong for this scenario because airborne gas residuals are chemical hazards, not biological waste. This would be the correct answer if the question asked to identify the hazardous toxic fumes that must be managed by the facility negative pressure ventilation system during ethylene oxide processing. Concept extension. All biohazardous waste must be placed in a red leak-proof bag or container marked with the International Biohazard symbol to ensure it is handled only by trained personnel and incinerated according to federal environmental standards. Question 128. While physically assembling a newly purchased orthopedic drill system at the illuminated workstation, an SP technician identifies several peripheral components in the kit. Which of the following items is specifically classified as an accessory for an electric-powered surgical instrument? Option A. Flexible reinforced high-pressure air hoses. Option B. External non-slip foot switches. Option C. Specialized nitrogen pressure regulators. Option D. Corrugated decontamination flushing hoses. Correct answer B. Knowledge point explanation. Core rationale. Electric-powered instruments utilize electricity from a wall outlet or a rechargeable battery. Accessories for these systems are typically electronic control interfaces such as foot switches, which allow the surgeon to activate the tool hands-free. Differentiating between electric and pneumatic accessories is critical for ensuring the correct power source is connected during assembly and testing. Trap analysis. Option A. This is wrong for this scenario because high-pressure air hoses are exclusive to pneumatic or gas-powered systems. This would be the correct answer if the technician was assembling a pneumatic bone saw that requires a connection to a compressed nitrogen tank. Option C. This is wrong for this scenario because pressure regulators are used to manage gas flow in pneumatic systems, not electrical voltage. This would be the correct answer if the technician was identifying the component mounted directly onto a nitrogen cylinder to control the air pressure delivered to a surgical tool. Option D. This is wrong for this scenario because decontamination hoses are cleaning tools used in the sink, not surgical accessories used during an operative procedure. This would be the correct answer if the question asked what device is connected to a powered handpiece to seal the internal motor from water during manual scrubbing. Concept extension. When processing electric accessories like foot switches, technicians must strictly follow the manufacturer instructions for use to ensure they are wiped down with appropriate disinfectants and never submerged, as fluid ingress will short-circuit the internal electronics. Question 129. While physically rearranging the scanning bins at the assembly workstation to actively resolve a recurring issue with missing orthopedic instruments, an SP technician implements a new workflow. This ability to evaluate a physical workflow and execute a practical solution is a key component of which professional attribute? Option A. Advanced interpersonal communication skills. Option B. Routine facility operational responsibilities. Option C. Basic environmental safety practices. Option D. Individual employability and professional value. Correct answer D. Knowledge point explanation. Core rationale. Employability skills, often called soft skills, include the ability to think critically, solve problems, and make informed decisions that improve departmental efficiency. A technician who proactively uses analytical skills to address quality defects is demonstrating high professional value, which makes them a more successful and desirable employee within the healthcare facility. Trap analysis. Option A. This is wrong for this scenario because communication refers specifically to the transmission of information, not the cognitive problem-solving process itself. This would be the correct answer if the technician was praised for how clearly they verbally explained the new barcode policy to their colleagues during a shift meeting. Option B. This is wrong for this scenario because operational responsibilities describe the tasks performed while analytical skills describe the mental approach to improving them. This would be the correct answer if the technician was strictly following a standard operating procedure to perform the daily mandatory check of the sterilizer water pressure gauge. Option C. This is wrong for this scenario because safety practices focus on physical hazard prevention, not workflow analysis. This would be the correct answer if the technician noticed a slip hazard on the floor and immediately placed a physical warning sign to protect their coworkers. Concept extension. Technicians are encouraged to use the Plan Do Check Act cycle as an analytical framework for problem solving, which empowers them to continuously improve the quality of the products they assemble for the operating room. Question 130. An SP technician is loading a sealed leak-proof biohazard bin onto a dedicated elevator to move it from the surgical floor to the decontamination area. What is one of the primary infection control goals of utilizing this specific transport method? Option A. To accelerate the chemical reaction of the enzymatic detergent. Option B. To guarantee that no instruments are accidentally misplaced. Option C. To actively prevent environmental cross-contamination. Option D. To achieve a high level of thermal disinfection during transit. Correct answer C. Knowledge point explanation. Core rationale. Contaminated instruments must be transported in a way that protects everyone in the facility. Utilizing sealed leak-proof and properly labeled containers ensures that infectious microorganisms, fluids, and aerosols are contained within the bin, actively preventing the spread of pathogens known as cross-contamination to public hallways, patients, and staff during the journey to the decontamination area. Trap analysis. Option A. This is wrong for this scenario because the goal of transport is containment and safety, not chemical acceleration. This would be the correct answer if the question asked about the purpose of maintaining the decontamination sink water temperature strictly between 109 and 140 degrees Fahrenheit. Option B. This is wrong for this scenario because misplacement is an inventory management issue, not an infection control goal. This would be the correct answer if the technician was implementing a dual signature count sheet to physically verify the contents of every surgical tray before it left the operating room. Option D. This is wrong for this scenario because transport is a movement phase. Disinfection happens later inside a machine. This would be the correct answer if the technician was describing the objective of the 180 degree Fahrenheit final rinse phase inside an automated washer disinfector. Concept extension. All transport carts and containers used for biohazardous items must be thoroughly cleaned and disinfected before they can be sent back to the operating room or used to transport clean supplies, completing the safe decontamination loop. Question 131. While physically scanning a barcode on a newly opened box of biological indicators, an SP technician observes the digital inventory terminal instantly generate a replenishment order at the central hospital warehouse. What specific defining characteristic governs this type of modern inventory tracking network? Option A. It is entirely disconnected from modern technological networks, utilizing a manual delivery courier. Option B. It is physically restricted exclusively to the surgical suites, never integrating with the central supply chain. Option C. It relies entirely on handwritten ledger entries, making it highly susceptible to human calculation errors. Option D. It is fundamentally computerized and relies on instantaneous digital data transmission across the facility-wide network. Correct answer D. Knowledge point explanation. Core rationale. Modern healthcare facilities require vast amounts of daily supplies to function. Automated supply replenishment systems utilize barcode scanners, radio frequency identification tags, and integrated facility-wide software to digitally track inventory in real time, removing the massive labor burden of manually counting boxes on shelves. Trap analysis. Option A. This is wrong for this scenario because automation inherently requires advanced technological integration. This would be the correct answer if the technician was describing an obsolete, pure paper-based ordering system reliant on physical mail delivery. Option B. This is wrong for this scenario because these computerized systems track commodities hospital-wide from the emergency department to the sterile processing decontamination sinks. This would be the correct answer if the question asked to define a highly specialized closed-loop medication dispensing cabinet located solely within the operating room core. Option C. This is wrong for this scenario because handwritten logs represent the exact manual inefficiency that automated systems are engineered to replace. This would be the correct answer if the technician was explaining the primary source of supply shortages in a rural clinic lacking basic internet infrastructure. Concept extension. Computerized replenishment systems prevent dangerous stockouts of critical sterilization indicators while simultaneously preventing the department from wasting capital on excessive expiring inventory. Question 132. While physically sorting components for a heavy-duty orthopedic drill system at the illuminated assembly workstation, an SP technician isolates a lightweight burr attachment. Under what specific condition is the technician permitted to process this single attachment inside a standard medical-grade paper plastic peel pouch? Option A. If the attachment fits universally onto any brand of pneumatic handpiece. Option B. If the component has just successfully completed a fully submerged mechanical wash cycle. Option C. If the attachment remains securely physically locked into the primary motor housing. Option D. If the original equipment manufacturer written instructions for use explicitly validate this packaging method. Correct answer D. Knowledge point explanation. Core rationale. Powered surgical instruments and their varied attachments are incredibly complex and expensive. A technician cannot arbitrarily decide how to package them based on their physical size or weight. Peel packaging a motorized attachment is strictly prohibited unless the device-specific manufacturer instructions for use explicitly state that a paper plastic pouch is a validated and approved sterile barrier for that exact item. Trap analysis. Option A. This is wrong for this scenario because cross-compatibility does not dictate the physical packaging requirements for sterilization. This would be the correct answer if the technician was identifying the mechanical function of a standardized Jacobs chuck mechanism on a generic surgical drill. Option B. This is wrong for this scenario because completing the wash cycle makes it safe to handle but does not dictate the acceptable terminal packaging material. This would be the correct answer if the question asked what physical milestone must be achieved before the technician is allowed to transfer the item from the decontamination zone to the clean inspection desk. Option C. This is wrong for this scenario because attachments must always be physically dismantled from the main handpiece to allow sterilant penetration into the connection points. This would be the correct answer if the technician was explaining a severely flawed processing technique that guarantees retained bioburden and a non-sterile outcome. Concept extension. Many heavy drill attachments possess sharp cutting teeth that will easily puncture a paper pouch during transport if pouched according to instructions. The technician must apply an approved tip protector to safeguard the fragile sterile barrier. Question 133. An SP technician has just finished running a massive fully loaded carriage of wrapped orthopedic trays in a 270-degree Fahrenheit steam sterilizer. At what precise physical moment does the facility formal sterile storage handling protocol officially commence for this specific batch of instruments? Option A. When the heavily soiled biohazard bins are first scanned into the decontamination holding zone. Option B. Only after the wrapped trays have completely reached ambient room temperature on the cooling racks. Option C. The exact instant the technician unseals and opens the heavy chamber door at the conclusion of the cycle. Option D. The moment the heavy carriage is manually pushed into the actively heated sterilizer chamber. Correct answer C. Knowledge point explanation. Core rationale. The sterile storage phase encompasses all physical actions taken to protect the sterilized goods until they reach the patient. This highly regulated process officially begins the exact second the sterilizer door is cracked open. The items are now sterile but intensely hot, wet, and highly vulnerable to contamination. Therefore, strict handling rules such as zero physical contact and controlled cooling immediately apply. Trap analysis. Option A. This is wrong for this scenario because scanning dirty bins marks the very beginning of the physical decontamination process, not the sterile storage phase. This would be the correct answer if the question asked when the contamination timer officially stops running for a set of soiled instruments arriving from surgery. Option B. This is wrong for this scenario because the critical physical cooling period itself is heavily governed by sterile storage policies. Waiting until they are cool ignores the highest risk portion of the workflow. This would be the correct answer if the question asked to identify the absolute prerequisite required before a technician is allowed to physically pick up and transfer a wrapped tray to a permanent shelving unit. Option D. This is wrong for this scenario because loading the chamber initiates the lethal thermal exposure phase. The items are completely unsterile at this point. This would be the correct answer if the technician was asked to define the exact physical starting boundary of the high-temperature processing cycle. Concept extension. To maintain the integrity of the newly initiated sterile storage phase, the technician must carefully position the cooling cart away from high-traffic walkways and direct air conditioning vents to prevent sudden temperature shocks that cause rapid internal condensation. Question 134. While physically verifying the cutting efficacy of a delicate 4.5-inch tenotomy scissor at the illuminated workstation, an SP technician prepares to test the sharp blades before placing it into an ophthalmic tray. Which specific color-coded standardized testing medium must the technician physically slice through to properly evaluate these short blades? Option A. A specific sheet of yellow latex-free testing material. Option B. A specific sheet of red latex-free testing material. Option C. A standard rigid paper index card. Option D. A specific sheet of orange latex-free testing material. Correct answer A. Knowledge point explanation. Core rationale. Scissors are classified by their physical length to dictate testing parameters. Instruments measuring 4.5 inches or shorter are classified as delicate or micro scissors. To test them without causing physical damage while accurately gauging their sharpness, industry standards mandate the exclusive use of yellow latex-free testing material, ensuring the blades cut smoothly from the hinge completely through to the extreme distal tips. Trap analysis. Option B. This is wrong for this scenario because the thicker red material requires too much physical force and is exclusively reserved for testing standard tissue scissors longer than 4.5 inches. This would be the correct answer if the technician was testing the cutting efficacy of a robust 7-inch Mayo or Metzenbaum scissor destined for an open abdominal tray. Option C. This is wrong for this scenario because slicing paper with surgical scissors physically dulls the microscopic edge. Paper is used strictly for testing bone-cutting instruments. This would be the correct answer if the technician was striking an orthopedic osteotome against a surface to ensure it cleanly sliced the material without snagging. Option D. This is wrong for this scenario because the orange material is a highly specific thicker medium engineered exclusively for testing minimally invasive shears. This would be the correct answer if the technician was physically evaluating the sharpness of a 5 mm laparoscopic scissor instrument featuring a long insulated shaft. Concept extension. If the delicate tenotomy scissor snags the yellow material or physically pushes it between the blades without cleanly severing it, the technician must immediately pull the instrument from circulation and send it out for professional sharpening. Question 135. A circulating nurse rushes into the sub-sterile room carrying a dropped one-of-a-kind cranial retractor and urgently requests that the SP technician perform a rapid uncontained immediate-use steam cycle. According to strict perioperative standards, under what precise physical conditions is the technician permitted to execute this highly restricted process? Option A. When attempting to process routine titanium hardware implants simply to save overall sterile processing turnaround time. Option B. When preparing to reprocess specialized single-use disposable trocars that have been opened onto the sterile field but not visibly soiled. Option C. Exclusively during unpredictable genuine clinical emergencies provided the dropped item has still undergone a complete rigorous physical manual decontamination wash. Option D. When attempting to rapidly neutralize heavily soiled instruments exposed to neurological tissues suspected of harboring transmissible spongiform encephalopathies. Correct answer C. Knowledge point explanation. Core rationale. Immediate use steam sterilization is a highly restricted procedure due to its elevated risks. AORN and AAMI standards mandate 2 unbending rules for its execution. It can only be utilized for genuine clinical emergencies like a dropped irreplaceable tool, and the item must still physically undergo the exact same meticulous, multi-step manual cleaning protocol as it would for terminal sterilization. You cannot sterilize dirt regardless of the emergency. Trap analysis. Option A. This is wrong for this scenario because regulatory standards universally prohibit processing implants via rapid cycles due to the absolute lack of required biological quarantine time. This would be the correct answer if the question asked to describe a dangerous non-compliant physical shortcut that would result in immediate severe citations during a Joint Commission survey. Option B. This is wrong for this scenario because single-use devices can never be physically reprocessed regardless of whether they were utilized or merely opened. This would be the correct answer if the question asked to identify a flagrant violation of the FDA strict single-use device regulations that introduces massive liability to the facility. Option D. This is wrong for this scenario because prion require massive extended physical exposure times at maximum temperatures to be denatured, making rapid cycles entirely ineffective. This would be the correct answer if the technician was asked to define a scenario where a standard 270° Fahrenheit cycle would catastrophically fail to physically protect the next surgical patient. Concept extension. If the technician lacks the proper lumen brushes or enzymatic chemicals at the substerile sink to thoroughly mechanically scrub the dropped retractor, they are strictly forbidden from initiating the immediate use cycle and must inform the nurse to find a substitute tool. Question 136. While manually wiping down a returned patient-controlled analgesia pump with an environmental disinfectant wipe, an SP technician visually notices that the digital display screen is deeply cracked. To ensure the unit undergoes a proper electronic safety inspection and physical functional test, to which specific hospital department must the technician route this damaged device? Option A. The Central Sterile Supply Division Processing Floor. Option B. The Clinical Biomedical Engineering Department Laboratory. Option C. The Infection Prevention Control Committee Administrative Office. Option D. The Environmental Services Housekeeping Team Supply Closet. Correct answer B. Knowledge point explanation. Core rationale. Patient care equipment containing electronic components and digital interfaces cannot be physically repaired by processing staff. The Clinical Biomedical Engineering Department is officially responsible for diagnosing, physically repairing, and safety testing all motorized and electronic patient care hardware before it can be safely returned to clinical circulation. Trap analysis. Option A. This is wrong for this scenario because the Central Sterile Division only physically cleans the exterior housing of the pumps. They do not perform electronic safety diagnostics. This would be the correct answer if the question asked where a floor nurse should physically send a pump covered in dried blood for immediate external decontamination. Option C. This is wrong for this scenario because infection prevention committees write epidemiological policies and track disease outbreaks, not physically repair broken circuit boards. This would be the correct answer if the technician needed authoritative guidance on formulating a new chemical wipe-down protocol for a novel viral pathogen. Option D. This is wrong for this scenario because the environmental services team handles architectural physical cleaning tasks like mopping floors and emptying trash, not medical device maintenance. This would be the correct answer if the technician needed someone to aggressively scrub and chemically sanitize the massive biological spill on the decontamination room floor. Concept extension. Any patient care equipment identified with severe physical structural damage during the manual cleaning phase must be immediately red tagged as defective to ensure no other technician accidentally dispenses the hazardous unit. Question 137. While actively restocking the sterile storage shelves, a materials management technician physically removes a depleted rolling wire rack and completely replaces it with an identical fully stocked rolling wire rack, pushing the empty one away. What is the specific logistical terminology for this dual rack physical supply replenishment method? Option A. The computerized periodic automatic replenishment system. Option B. the individualized surgical case cart distribution protocol. Option C, the department-wide twin exchange cart system. Option D, the on-demand electronic clinical requisition method. Correct answer C. Knowledge point explanation. Core rationale. The exchange cart system is an inventory methodology utilizing two completely identical physical supply carts. One fully loaded cart is stationed on the clinical floor for active use while the exact duplicate is held in the central supply area. When the clinical cart is depleted, personnel physically swap the empty cart for the full one, creating a seamless rapid inventory rotation. Trap analysis. Option A. This is wrong for this scenario because a periodic automatic system involves physically bringing individual boxes of supplies to a stationary shelf to meet a par level, not physically swapping the entire shelf unit itself. This would be the correct answer if the technician was using a barcode scanner to reorder exactly 12 boxes of surgical tape to fill a static wall-mounted storage bin. Option B. This is wrong for this scenario because a case cart is uniquely built for one specific patient surgery, not used as a general bulk supply rack for an entire department. This would be the correct answer if the technician was loading a closed trolley with a specific physician-requested retractors and sutures for a scheduled laparotomy. Option D. This is wrong for this scenario because a requisition is a targeted electronic request for a missing individual item, not a massive physical rolling cart exchange. This would be the correct answer if a floor nurse filled out a digital ticket to urgently request a single sterile wash basin that was missing from their standard par-level closet. Concept extension. The exchange cart system requires extensive duplicate physical inventory investments, meaning the facility must purchase twice the amount of actual supplies to ensure both the active cart and the backup cart are fully outfitted at all times. Question 138. During a busy shift in the preparation area, an assembly technician independently decides to physically halt the packaging line and reject an entire batch of retractors because they detect residual moisture in the box locks without needing to ask a supervisor for permission. What specific modern quality management concept allows the frontline technician to exercise this direct physical operational authority? Option A, frontline employee empowerment. Option B, retrospective root cause analysis. Option C, random peer review auditing. Option D, lean manufacturing workflow optimization. Correct answer A. Knowledge point explanation. Core rationale. Empowerment is a critical structural element of modern quality programs. It involves transferring physical decision-making authority directly to the frontline staff performing the work. By allowing the assembly technician to physically halt production upon discovering an error without fear of managerial retaliation, the facility ensures defects are caught and resolved immediately at the source. Trap analysis. Option B. This is wrong for this scenario because a root cause analysis is an investigative tool utilized after a major error has already occurred and harmed the system, not the real-time authority to physically stop an error in progress. This would be the correct answer if the department manager was hosting a formal meeting to figure out exactly why the mechanical washer failed to physically dry the retractors in the first place. Option C. This is wrong for this scenario because the technician is evaluating the physical instruments themselves, not auditing the work performance of a fellow coworker. This would be the correct answer if a designated shift leader was silently physically observing the technician manual wrapping technique to score their compliance with aseptic folding protocols. Option D. This is wrong for this scenario because lean optimization eliminates physical wasted motion and unnecessary steps in a process. It does not explicitly define the transfer of authoritative power. This would be the correct answer if the technician actively reorganized their physical workstation to ensure all indicator tapes and locks were within arm's reach to prevent unnecessary walking. Concept extension. True quality management requires continuous feedback from all levels. An empowered technician must feel confident reporting consistent physical washer malfunctions to leadership so permanent systemic repairs can be implemented. Question 139. Upon physically unlatching and opening a rigid sterilization container after a dynamic air removal cycle, an SP technician observes that the internal chemical indicator strip has only partially transitioned to its dark endpoint color. Which of the following procedural or mechanical physical errors would directly cause this specific inadequate chemical reaction? Option A. Placing the indicator strip physically too close to the internal biological vial within the basket. Option B. Selecting a passive gravity displacement cycle on the sterilizer console for a heavy orthopedic load. Option C. Allowing the sealed container to physically cool down on the rack for an insufficient amount of time. Option D. Utilizing a physically oversized tamper-evident seal on the container exterior locking latch. Correct answer B. Knowledge point explanation. Core rationale. A chemical indicator requires specific physical parameters, time, temperature, and sterilant contact to fully change color. If a technician incorrectly selects a passive gravity cycle instead of a dynamic air removal cycle for a complex heavy load, the dense cold air will remain permanently trapped inside the rigid container. This trapped air physically blocks the pressurized steam from contacting the indicator strip, resulting in a failed, incomplete color change. Trap analysis. Option A. This is wrong for this scenario because placing an indicator physically near a biological vial is actually a recommended practice for challenge testing. It does not inhibit the chemical reaction. This would be the correct answer if the question asked to describe the proper spatial arrangement of testing devices within a customized physical process challenge pack. Option C. This is wrong for this scenario because the chemical color change happens dynamically during the intense physical heat of the exposure phase, not during the ambient cooling phase on the storage rack. This would be the correct answer if the technician physically opened the container and discovered extensive pools of condensed liquid water covering the bottom of the tray. Option D. This is wrong for this scenario because a physically oversized exterior seal on the latch has absolutely no effect on the internal thermodynamic steam penetration of the chamber. This would be the correct answer if the technician struggled to manually physically break the thick plastic lock upon delivering the container to the operating room nurse. Concept extension. A failed internal chemical indicator instantly renders the entire physical rigid container unsterile and unfit for patient use, mandating that the surgical team completely reject the tray and physically return it to the decontamination area for total reprocessing. Question 140. A decontamination technician physically lowers a heavy metal basket full of multi-hinged rongeurs into an active ultrasonic console. What is the exclusive physical objective of the microscopic imploding bubbles generated within this specific liquid bath? Option A. To rapidly physically cool the metal instruments following intense thermal exposure. Option B. To achieve a validated high-level chemical disinfection of the instrument surfaces. Option C. To thoroughly clean and physically dislodge trapped dried bioburden from the deep box lock crevices. Option D. To permanently chemically passivate the stainless steel surface against future rust formation. Correct answer C. Knowledge point explanation. Core rationale. Ultrasonic cleaners are mechanical cleaning devices. They emit high-frequency sound waves that generate microscopic vacuum bubbles in the detergent fluid. When these bubbles violently physically implode against the metal surface, a process known as cavitation, they create an intense scrubbing vacuum that physically pulls dried blood and tissue out of the deepest hinges and box locks. Its sole purpose is rigorous physical cleaning. Trap analysis. Option A. This is wrong for this scenario because the ultrasonic bath utilizes warm water and energetic physical friction which heats the instruments rather than cooling them. This would be the correct answer if the technician was explaining the physical purpose of utilizing a fan-assisted staging rack immediately after physically pulling a hot cart from the steam sterilizer. Option B. This is wrong for this scenario because an ultrasonic console utilizes enzymatic detergent to physically clean, not a biocidal agent designed to eradicate pathogenic microorganisms. This would be the correct answer if the technician physically submerged a clean flexible endoscope into a tightly covered basin filled with a potent orthothialdehyde solution. Option D. This is wrong for this scenario because passivation is a chemical repair process applied during manufacturing or specialized repair, not a daily mechanical physical cleaning action. This would be the correct answer if a vendor was applying a specialized nitric acid bath to physically restore the chromium oxide layer on a newly milled surgical clamp. Concept extension. Instruments processed in an ultrasonic cleaner are still heavily physically contaminated with live pathogens upon removal and must be subjected to a thorough thermal or chemical disinfection phase before they can be safely handled in the clean assembly area.